This is a crisis. We have to hold the fronts.
Dr. John Bookvar has been a doctor for 20 years. He's a brain surgeon at one of New York City's most well-known hospitals. But now he's not working in the OR, he's headed to the ER, the front line in the war against COVID-19.
I'm a neurosurgeon, and frankly, I haven't intubated a patient in many years.
And that means relearning emergency medical care.
We are soldiers fighting this invisible virus. And we enter the trenches every day when we go into the hospital, whether it's in our emergency rooms, whether it's on our intensive care units.
The sheer magnitude of the virus outbreak is like a wave about to overtake the U.S. healthcare system. More than 43,000 sick, at least 550 dead. To help relieve that burden, tens of millions of Americans have been told to stay at home. So far, at least 20 states have already implemented or announced closures of non-essential businesses.
We are the epicenter of this crisis.
With more than 12,000 positive test results, New York City has more cases than any one single location in the country.
To all hospitals, mandatory directive from the state. Find more beds, use more rooms.
It feels like I'm fighting a fire with blindfolds on.
Emergency room doctor Darian Sutton is among those sounding the alarm.
Because patients are coming in with respiratory symptoms, we normally can put them in isolation rooms, but we only have a numbered amount of those. And so once those run out, then we have patients that have to sit in the hallway or in places where they may expose other people to the infection.
He says the shortages of resources will lead to bigger issues.
The reality is that there's a very high chance that my colleagues can get sick. And one of the main reasons why is because we have such a limited amount of protective equipment. We're not superheroes, as many people paint us.
New York has tested more people than any other state. So far, the people who test positive, 13% require hospitalization. Of those, nearly a quarter are in intensive care. Testing in the city and its suburbs is going up. This weekend, cars started lining up at a drive-through facility in neighboring New Jersey. The site hit capacity just a half hour after opening. With the massive influx of patients, New York is calling on the federal government to help, while also trying to buy more supplies.
Masks that we paid 85 cents for, we're now paying $7. Why? Because California is bidding and Illinois is bidding and Texas is bidding and Florida is bidding. It makes no sense. The federal government must nationalize the equipment production and supply issue.
Internal memos written by Columbia University's chief surgeon, Dr. Greg Smith, say that his hospitals have seen a 50% increase in coronavirus patients. The chief of surgery at Columbia University warning in a memo to staff, the hospital normally uses 4,000 non-N95 masks a day. Currently, they are consuming 40,000 such masks per day. Dr. Cornelia Griggs is a surgery fellow at Columbia University.
Having to make the split-second decision, am I going to run into this room to save this patient, or am I going to take the time to try and scramble and find a mask?
And it's not just in the hospitals. The commissioner of the FDNY is worried about his EMTs and fire crews.
Basically, what they're protected with for these types of assignments are gloves, eye protection, masks, and disposable robes. The burn rate for these PPE equipment is very high.
Like in hospitals, his teams are losing numbers as first responders test positive for COVID-19.
It's very personal. Each and every day I get a report and the numbers climb.
City and state officials here are sending out the SOS for help.
This is phase 2, as Commissioner Murphy just mentioned.
Today, New York Governor Andrew Cuomo toured the Javits Center in Midtown Manhattan. The facility usually hosts some of the country's biggest industry conventions. Now, home to a temporary FEMA hospital. He's also putting out the call for any reserve medical personnel to step forward.
I'm contacting all the retired nurses, all retired doctors. I'm asking medical schools to make their staff available, nursing schools to make their staff available.
The federal government is sending the USNS Comfort to New York, a Navy hospital ship. It will also handle overflow from city facilities, but not any COVID-19 patients.
It is not necessarily so easy to transport patients to a floating hospital in New York Harbor. It would be much easier to do so at something like the Javits Convention Center. However, we're still going to run into a staff shortage. So just because there are beds doesn't mean there's staff and doesn't mean there's ventilators.
In fact, the city only had a week's worth of ventilators left. But this afternoon, the federal government sent a lifeline, 400 more.
That 400, tremendously helpful, and it's going to help us get through this week into next week. Again, our request is for 15,000 to get us through April and May.
New York Fire Commissioner Nigro helped lead the FDNY through the aftermath of 9/11 and says this city can show the country how to persevere through crisis again.
The world was divided between your life before and your life after what happened on 9/11. I think right now in this pandemic, most of us have a life before, and we have today's life, which is the pandemic 24/7. And once again, we will be strong as we were then.
And strength, we are learning, just like the virus, knows no boundaries. Strength witnessed in hospitals across the country.
I have tremendous amounts of hope because every day I get to work and I see the people that are working tirelessly to solve this problem and to fight this problem.
Every single day, 24 hours a day, 7 days a week, men and women are leaving their loved ones behind and going into the face of danger. And I can't tell you how proud I am to be amongst some of the most courageous and caring human beings I've ever seen.
Earlier today, I spoke with New Jersey Governor Phil Murphy about how he's fighting the pandemic there. Governor, thank you so much for joining us. Your state, New Jersey, has the second highest number of confirmed cases in the country. You've compared this medical crisis to a war. So in this war, do you and your medical workers in New Jersey have the weapons that you need?
Byron, good to be with you, first of all, but the answer is no. We do not have the equipment that we need. I'm grateful that we've gotten a second installment on its way from the strategic stockpile nationally of personal protective equipment, but we need more.
Late last night, as you know, the president tweeted that, quote, "We cannot let the cure be worse than the problem itself." And some have speculated whether the economy cost of strict social distancing outweighs the public health benefit from it. What do you think?
Well, I think I'm pretty well self-declared in the category of let's take the pain now, and the pain is enormous, by the way. Workers who are out of work. But I have to tell you, our numbers in terms of the virus are going up and not down, at least in the near term, and we've got to be vigilant about that.
Governor, what do you make of what the governor of Florida has said, saying that anyone traveling from New Jersey or New York to self-isolate for 14 days?
That's the first time I'm hearing it. I would just say this: any amount of social distancing, any amount of self-help that folks can give to themselves and their families, their neighbors, their friends. And the key is to flatten the curve.
Governor, one of your state-run drive-through testing centers exceeded capacity even before it opened. How do you meet that need moving forward?
Listen, there's an enormous pent-up demand. Again, I want to thank our FEMA partners that helped us open 2 drive-through testing sites in the past week. They're both working, but the problem, of course, is there's a lot more people who want to get tested than we have the equipment or manpower to test. We'll do everything we can. At a certain point, we'll have a fork in the road between testing and putting a lot of that manpower and equipment into care.
Fork in the road? What did you mean?
So in a perfect world, we want to test everybody. Absent a lot more raw material, and absent another wave of healthcare workers, we're going to have choices coming up in the next number of weeks between diverting those resources, both human and equipment, to testing or toward care of those who are sick. Now, I'm an optimist, and I'm pounding away every single day on getting that equipment to allow us to do both. And that's my hope. Although we're hoping for the best, we're preparing for the worst.
Governor Phil Murphy of New Jersey, thank you, sir. Godspeed to you and your citizens.
Same to you, Byron. Thanks for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.